In this lecture, we will assess and classify the sick child according to the WHO program and what's called integrated management of childhood illnesses. First, we start by a scenarios case history. In this classification, you consider yourself as a general practitioner, you working in the primary health centers. Doctor, and how can you refer the patient to the hospital, and how can you manage the patient at the health center and refer to home? So, an example of this case history, a 7-month-old infant had been presented with cough and shortness of breathing of 2 days duration, with a preceding history of flu-like illnesses. Baby had developed vomiting once and with mild decrease in his appetite. On examination, he is conscious, his heart rate is 130 per minute, his respiratory rate is 52 breaths per minute. On examination of the chest, there is a subcostal and intercostal retraction. It's meaning chest syndrome. So, from this scenario, you should decide where's any danger sign. We discuss later on. Suppose you are reading the lecture previously and you know what are the danger signs. So danger sign is vomiting everything, convulsion, disturbed conscious level. So in these scenarios, we don't find any danger sign. And we should look, does the child have chest syndrome? Yes, he had chest syndrome. And he had fast breathing. His respiratory is 52 breaths per minute. So he had just round and fast breathing. So we should answer the question on this case history. How can I classify the patient problem according to this program or later on discuss? As we mentioned, there are no danger signs. The baby has chest syndrome plus fast breathing. So we classified the patient as severe pneumonia. Later on, we'll discuss detailed what I mean by this severe pneumonia and what are the line of management we will discuss later on. So, from this lecture, what we went to learn, our learning objective, you should assess the child for symptom and sign related to the main problems. You should classify the illness according to the signs which are present or absent. We should have proper initial management steps, and you should educate the family about the danger sign and home care of different acute respiratory tract infection. When a main symptom present, you should assess the child, as we mentioned, classify the problem and treating the child. As you mentioned, you are considered as a general practitioner in the primary health center, and we will discuss which case we'll send home and which case we'll send to the hospital. So, in any patient who's come to you in the primary health center, we should check for what's called general danger sign. Assess for general danger sign, we should ask about a child is not able to drink or breastfeed. The child has had convulsion. The child vomiting everything, not once or twice. And you should look for the child lethargy or unconscious, whether the child is convulsion now. So, any of these signs consider a danger sign. When any of this danger sign the baby have, we should classify him as very severe disease. Any previous danger sign, we classify the patient as very severe disease. Treat this patient in the following steps. Should treat convulsion if present. Complete assessment immediately. Give first dose of appropriate antibiotics. Prevent low sugars and refer immediately to the hospital. How can we treat convulsion? Child, can give him diazepam rectally. We manage the airway. Turn the child on his side, left lateral position. Don't insert anything in the mouth. If the lips and tongue are blue, open the mouth and make sure the airway is clear. If necessary, remove secretion from the mouth, throat, through a catheter inserted through the nose. So it's initial supportive measures. How can you give diazepam rectally? We draw up a dose from an ampoule of diazepam into a small syringe. Then we remove the needle. Insert approximately 5 cm of nasogastric tube or the tip of the syringe into the rectum. Inject the diazepam solution into the nasogastric tube and flush it with 2 ml of room temp waters. Hold buttocks together for a few minutes to make the drugs work. If the baby have fever, should lower the fever by giving paracetamol. Sponge the child with room temperatures water. And should treat child to prevent low sugars. How can you prevent low sugars? Treat the child to prevent low sugar. If the child is able to breastfeed, ask the mother to breastfeed. If the child not able to breastfeed but is able to swallow, give expressed breast milk or breast milk substitute as milk. If neither of these is available, give sugar water. We give 30 to 50 ml of milk or sugar water before referral. So how can we make a sugar water? We dissolve 4 teaspoons of sugar, 20 grams, and 200 ml or cup of clean water. If the child not able to swallow, give 50 ml of milk or sugar water by nasogastric tube. So this is the initial measurement in the primary health center. We treat convulsion, treatment low sugars, control his temperature, and refer him to the hospital after giving first dose of proper antibiotics. Later, how can you classify the patients come to us with cough and difficult breathing? So, most children have 4 to 6 acute respiratory tract infection each year. In any part of the respiratory tract, we may get infection of the nose, throat, larynx, trachea, air passage, or the lung. A child with cough or difficult breathing may have pneumonia or another severe respiratory tract infection. Pneumonia is an infection of the lung. Both bacterial and viral can cause pneumonia. What could be the sign and symptom of infection the child come with? We may have cough, difficult breathing, sore throat, running nose, and ear problem. So we should ask and look for following problem. Does the child have cough or difficult breathing? If yes, ask for how long. So any child with cough more than 30 days should refer for assessment. You should look and listen. Count the breathing in 1 minute. You chose 1 minute because the child may get sometimes periodic breathing and he should take the breathing in 1 minute. Look for the chest syndrome, which means subcostal recession or retraction. Look and listen for stridor. Look and listen for wheeze. What mean by difficult breathing? Difficult breathing refers to the unusual pattern of breathing in a child. Mothers may describe it in a different way. For example, they may use the term noisy, fast, or interrupted breathing. Some definition: chest syndrome. What mean by chest syndrome? When a child breathing in, the lower chest wall move in. If only the soft tissue below the ribs or above the clavicle go in, it's not a chest syndrome. A mild chest syndrome is a normal in young infant. Severe chest syndrome is a sign of pneumonia. Wheeze. Wheeze defined as soft musical noise during expiration, and you listen to the wheeze by holding your ear near the child's mouth. Wheeze is the passage of the air through a narrow airways. Stridor is a harsh noise made when the child breathes in, usually happening during inspiration, whether the wheeze mainly happening during expiration. How can you define fast breathing? Fast breathing defined according to the child age or infant. A young infant less than 2 months, if he gets 6 breaths per minute or more is considered as fast breathing. A child from 2 months to 1 year, if have 50 breaths per minute or more is considered as tachypnea. A child from 12 months up to 5 years, if he gets 40 breaths per minute or more, is considered him as fast breathing. So it's very important to know the cut line of fast breathing. So you reassess the child for any danger sign, stridor on a calm child or chest syndrome. Also, if there is wheeze, should treat wheeze. If a child has those signs, chest syndrome, fast breathing, and stridor, you should assess him as severe pneumonia. So this is the second class. First class, very severe disease, if the baby has any danger sign. And now this is severe pneumonia, if the baby has a chest syndrome or stridor, a quiet child. So how can you manage this patient? Give first dose of inappropriate antibiotics. Treat wheeze if present. Prevent low sugar and refer urgently to hospital. So this is the second class to be referred to the hospital. The first very severe disease and in severe pneumonia. Third class or third group of classification, if the baby has just fast breathing, no chest syndrome, and no danger sign. If there's any wheeze, should treat wheeze. So we classify the patient as pneumonia. So we get very severe disease, severe pneumonia, pneumonia. Pneumonia equal to fast breathing alone. How can you manage the patient? Give appropriate antibiotic for 5 days. Treatment of wheeze if present. Soothing the throat and relieve the cough with a safe remodeling. Use a homemade fluid, soup, warm, tea. Follow up in 2 days and advise the mother to return immediately if any sign and symptom of deterioration. In fellow patient within 2 days, if the baby come after 2 days is worsening, we change the antibiotics. If he is the same, we'll continue on antibiotics. If he is improving, continue. If the same, we change antibiotics. And if the patient is worsening, we refer to the hospital. He may get more worse sign. If the baby you have no sign of pneumonia, he had no chest syndrome, no fast breathing, no any danger sign, we classified him as no pneumonia, or what's called cough or cold. And this is the fourth class. So we get very severe disease, severe pneumonia, pneumonia, and no pneumonia. In this classification, how can you manage patient? If there's a wheeze, we should treat wheeze, and we'll take later on what are treat wheeze. If cough more than 30 days, we should refer for assessment. This baby may get foreign body, he may get TB, pertussis, asthmatic patient. Soothing the throat and relieve the cough with a safe remodeling, as we say, with homemade fluids or diet. Advise the mother when to return immediately. If there is any deterioration or any tachypnea, fast breathing, and follow up within 2 days. If we is present, we should follow the patient within 2 days. Follow up in 5 days if no improving. And we ask the mother to return back. The baby has reluctant to feed, he develop fever, increased respiratory distress. Now, if the baby gets wheeze with other symptoms and signs, how can you manage him? Children with wheeze and general danger sign or stridor, give 1 dose of rapid-acting bronchodilator and refer urgently to the hospital. So we can give him salbutamol with a nebulizer at the primary health center and refer him to the hospital because he have general danger sign and very severe disease. In child with wheeze and no general danger sign, but he get chest indrawing with or without fast breathing. In this condition, we give 1 dose of rapid-acting bronchodilator and reassess the child 30 minutes later on. So in this classification, the patient has got severe pneumonia. If we give him bronchodilator and the chest indrawing resolve is just fast breathing, mean that the patient convert to classification of pneumonia and can manage him at home. If the patient after treatment of wheeze and still having persist chest indrawing, so still he have severe pneumonia and should refer to the hospital. So in those patients with chest indrawing plus wheeze, we treat wheeze and wait for 30 minutes for reassessment. If he is improving the chest indrawing, we treat him as pneumonia. If he has persist chest indrawing, we refer to the hospital. So if fast breathing alone, we treat for pneumonia and give oral antibiotic for oral salbutamol for 5 days and should follow the patient within 2 days for further assessment. If the baby have wheeze without chest indrawing and no fast breathing, so as cough and cold, give oral salbutamol for 5 days and follow up patient within 2 days if wheeze persists. So, in summary, we get 4 classification of the cough and difficult breathing for the patient with age from 2 months to 5 years. We get very severe disease, the patient have danger sign. You get severe pneumonia if the patient have chest indrawing plus fast breathing, and you get pneumonia if the baby got just fast breathing. If the patient have cough and cold, have no fast breathing, no chest indrawing, we classify them as cough and cold. Another group of patients that the baby is younger than 2 months, you classify them in another classification. There are 2 classifications. First, what's called possible serious bacterial infection, and second, called local bacterial infection. So, we should look for the following sign to classify the patient as a possible serious bacterial infection. If the baby has convulsion, not able to faint, fast breathing, severe chest indrawing, nasal flaring, grunting, wheeze, stridor, pulse fontanelle, pus from the ear, if the baby has hyperthermia or hypothermia, and the baby has lethargy, convulsion, step conscious level, all the signs make us classify the patient as possible serious bacterial infection. So any baby below 2 months have different classification. In this condition, how can you treat patient with possible serious bacterial infection? First, give first dose of appropriate antibiotics, treat to prevent low sugars, advise the mother how to keep the baby warm in the way to the hospital, and refer urgently to the hospital. Another classification, what's called local bacterial infection. If the baby has red umbilicus or drying pus, skin pustule, or pus draining from the eyes, we classify it as local bacterial infection. And in this condition, we should give appropriate oral antibiotics, teach the mother to treat the local infections, advise the mother to give home care for the young infant, follow up within 2 days for any deterioration, advise the mother if the sick infant develop any problem to return back immediately. It's become poor feeding, lethargy, dyspnea, return back immediately. So below infant below 2 months have different classification. So this is the summary for management of baby according to the integrated management of childhood illness or according to the WHO programs. And thank you for listening.